Hi, my name is Debbie Komisak. I am doing this video submission for the critical evaluation of a qualitative or quantitative research study. I chose to evaluate the study entitled Staff Practices, Attitudes, and Knowledge Skills Regarding Evidence-Based Practice Before and After an Educational Intervention. I found this article interesting in that it found nurses with associate degrees or diplomas in nursing not familiar with evidence-based practice. And since I'm a nurse for over 30 years, I have never heard of the phrase evidence-based practice until I most recently started working in a medical center, and they use that terminology a lot. Evaluating the credibility of the research article per the components of the checklist in Hauser 2018, I found the following. As for the authors having applicable clinical and educational credentials, I say yes to this. It is evident. Author Dean Mullen has a PhD and works in nursing administration. Listed in her skills and expertise is evidence-based planning, among others. Author Anna Maria Gallo is also an RN with a PhD. She did research on several evidence-based programs. Author Willa Lee Frietz, also an RN and professor, did research articles on evidence-based practice. Author Rebecca Wagner is an RN at Sharp Grossman Hospital, and that hospital is where the study was conducted. Jackie Sosis, RCP, and Brandy Gustafson is also from Sharp Gross Mountain Hospital, is a DPT, and Sanjay Kim is an RN and PhD, and he has published several evidence-based practice articles. With having several authors, the research is enhanced since there is a variety of points of view, and it can benefit all the authors on the team because they have each other to work with. On the checklist, I can find no evidence of any conflicting interests within the list of authors, and it is also stated that they have no financial interests of loss or gains. There is evidence that this journal article was peer-reviewed. The article issue was identified by volume and number, being volume 43, number 9. I could not find any evidence that it is a publication, that its publication has any financial gains or losses. I couldn't find the exact study of this article, the exact date when it was done, only that it was a 2-month study and it was published in 2012. Evaluating the problem statement and research design. Finding research problems starts with a concern that is part of a topic of interest. They start off as expansive lists and are refined down to one problem area. In evaluating the problem statement from my chosen article, I found in the development that the article narrowed from the general to the specific. It began with different disciplines, awareness of evidence-based practice, and concluded with how nurses can expand their knowledge to learn evidence-based practice. The problem is clearly stated and repeated throughout the article that evidence-based practice needs to be used. The concern is articulated in the article by citing the study of a pre- and post-survey to examine the effect of evidence-based practice teaching. The significance is present in the article as it explains the purpose and importance of evidence-based practice. The article had two theory framework to guide the study. Quote, the adult learner theory, end quote, and the diffusion of innovation theory, in quotes. Those were the studies that they used. I feel the article will improve organizational processes, as it concludes that giving online learning may not be the best way to teach evidence-based practices to nurses. The ethical issues in the study consist of the following. In the article, there was no subjects that needed protection from harm. Approval from IRB was not needed since there was no research involving the people, as well as no informed consent was needed. Anonymity and confidentiality was not approached in this article. There was only evidence of coercion in this article, in that there were several statements indicating reminders to participants to complete their questionnaire. Full disclosure was included, as it was on a questionnaire. Risks, benefits were not relative to this article and its participants. The participants were recruited through staff meetings, posted flyers, and email and newsletters. The purpose statement of this article is as follows per the checklist. The development narrowed from the problem of having employees use evidence-based practice to evaluating if clinicians learn evidence-based practice with self-learning tools. The purpose is stated in this article and can be found early in the article and easily. It is in the background blocked statement. The purpose is written. The purpose is a written statement stating, quote, the multidisciplinary study assessed nurses' baseline and post-education practice, attitude, and knowledge skills regarding evidence-based practice. The verb would be assessed, which is unbiased. The design is described as a pre and post survey. It is also included variable in the participation and instrument used and how they were measured. The population was described as the participants who were participating in bedside care, and they were included in the study. The setting is specified, as the article stated. The participants could do their survey during work hours, or they could also do it at home on their own time. The feasibility, as in the required resources, are stated as it was a packet of data collection packet. Ethically, the packet contained informed consent letter. The article was aligned from the purpose statement to the design. The literature review, I wasn't sure when the survey was concluded, and I couldn't find that information, although it was published in 2012. Most of the studies used were done between 2005 to 2011. The relationship of the research problem to the previous research is made clear by citing the studies on evidence-based practice that were done in the previous years. There are several major studies that are related to the evidence-based practice topic. The review is linked direct to the research questions, stating, quote, although this study did not provide many statistically significant correlation within evidence-based practice subscales or in relation to demographic data, they're way valuable information is gained from the results and directly stating that. Skills comes only through multiple exposures and repeated practice of evidence-based practice. The review supported the importance of the study by including that to enhance patient care, evidence-based practice must be used. The author used primary sources in their article as evidenced by their references. The review is unbiased and it includes conclusive findings. This is evidenced in the data analysis and results section of the article. I cannot appreciate that the author's opinion was detectable. This review had a logical organization to it, in that it states how evidence-based practice is improves clinical care and goes on to support the need for that research. In this article, the conclusion summarizes the important knowledge of the topic, that being that evidence-based practice is important for improving patient outcomes. The sample strategy of the article is the target population was clearly identified as clinicians who work at the bedside and direct patient care. The inclusion criteria was direct patient care, specific time frame, and the demographics were stated in there. And the exclusion criteria was met by identifying non-direct patient care individuals will not participate in this study. The procedure for selecting the participants are specified. Sampling procedures are stated in the article as staff practice, attitudes, and knowledge skills, along with a demographic questionnaire. Sampling bias was controlled by not including non-direct patient care staff. The sample was a possible 1,381 staff members being able to participate. However, only 609 participants completed the survey. I couldn't find power analysis was done in this article. With evaluating the measurement strategy, I found the instruments were clearly linked to the concepts of the research question. The use of bar graphs and tables were describe the outcomes objectively. I could not locate in the predictor variable section of the article that supporting statistics were provided. In evaluating the study results, the quantitative nature is made clear early in the study in the background section of the article. I could not find a rationale for the choice of the design, which is a descriptive pre- and post-survey design. I could not find a specific procedure being described for the application of the treatment or intervention. The instruments and measurements were described objectively by the use of tables and bar graphs. The supporting statistics of the tables and bar graphs were provided, as were the validity of the instrumentation. A detailed protocol for the use of the instrument was described by using evidence-based practice questionnaire. The internal validity is identified and controlled by the use of demographic information and using a 5-point Likert scale. I did not appreciate where the authors provided sufficient information to determine whether the findings can be generalized to other groups. That concludes my submission on the evaluation of the research study. Thank you.